I'm Matt Schmidgall. I'm the school programs manager here at the Pima County Health Department. We have started recording on this call. And so if you have colleagues that aren't able to join us today, they're always welcome to watch the recording afterwards. Today's meeting is going to be a little bit different. We are going to go through our typical announcements and do a quick COVID update, and then I'll actually be turning it over to Dr. Lowe from the University of Arizona, who's going to talk a little bit about our stock inhaler program for this school year. So our announcements, just want to keep plugging our vaccine equity team that is available to come out to schools and do COVID-19 vaccines if you would find that helpful. They did let me know yesterday that the new boosters have been authorized, but what this means is that with the authorization of the new boosters, the old ones are no longer authorized and have been discontinued immediately. So our clinics and our vaccine equity team is expecting the new boosters to arrive early to mid-September. And as soon as those arrive, we'll be able to administer those. The Pfizer booster is available for those 12 and up, Moderna for 18 and older. And if your school had happened to already schedule a clinic for boosters for the old boosters that's happening before we get the new ones, those are going to unfortunately have to be rescheduled. We also are going through a couple of staffing changes again here on our team. Kat Davis, who most of you are familiar with, accepted a promotion as the division manager for our public health emergency preparedness team. So she has been phasing out. And then Candy Pipes, who has been offering pretty much a ton of administrative support, answering questions and organizing these calls. She's also transitioning over along with Kat. So we are recruiting for our team here. If you know anyone who'd be a good fit over here at the health department, tell them to come apply. All right, moving into our COVID update. So as always, just want to let folks know this data is about a week behind because the new data will come out later this afternoon. The good news is our community level is low, so we are still green. However, we still are in that high rate of transmission, although our case rate went down pretty significantly this past week. So we're down about 25%. And then as far as those who are fully vaccinated and up to date, I should say, that went up about 0.1% from the last time we reported. So we're hovering just around 50%. Here you can see a little bit more information on how that community level is determined and where our data stands. And again, these slides will be available after the call. If you'd like to find the most recent data that is released by the CDC, usually later this afternoon, you can hop on their website and all of this will be updated. Here's a look at our map. It's looking better. We're seeing a drop in red and a slight increase in the green. So that's really good, especially over here in our region of the country. And then our transmission map, some red has turned orange, but still seeing high transmission throughout the country. And that's about all I have for you today. Wanted to allow Dr. Lowe plenty of time. As always, if you have any questions, go ahead and give us a call, or for probably a quicker response, you can email schoolsupport@pima.gov, and I or someone will get back to you as soon as we're able to. And with that, Dr. Lowe, are you on the call?
I am here. Can you hear me?
We sure can. You should have permission to share screen, so I'll let you take it away from here.
Fantastic. Let's see if I can navigate Teams, and I apologize for the lighting behind me, but I'm making do this morning. Okay. You would think after all this virtual meetings we've had, I could figure out how to share slides in Teams, but not here nor there.
So up at the very top, oh, you found it, I think.
Yeah,
there,
but can you,
okay.
You're seeing my Teams chat, right?
Yeah.
Okay, I think we got it here.
There we go.
Wow, thank you all for your patience. And I'm gonna try to go through this relatively quickly. So I'm Dr. Ashley Lowe from the University of Arizona Health Sciences, Asthma and Airway Disease Research Center. I basically specialize in school-based health, but most of my experience is in clinical research and pediatric asthma. I've been working with Matt and the health department for several years on a program that's near and dear to my heart. And since I know that this call includes schools that have not previously participated in this program, I wanted to provide just a brief overview of what the program is, and then also outline the next steps for this academic school year for schools that are currently participating in the program. So again, I introduced myself, and I'm happy to be here on this call. Thank you, Matt, for the time to be able to deliver this message to this wonderful audience that we have. And then we're just going to briefly talk about asthma in schools, why it is a problem, discuss the Pima County Stock Inhaler for Schools program background, and basically how your school can participate, whether you are not participating or if you are participating. And then I'll give you my contact information so you can reach me if necessary. So I just wanted to start it out with this quote. This comes from actually a friend in Baltimore who was a licensed school nurse. And as the quote reads, Elaine said, in October 2018, 2 students reported another was having difficulty breathing. When I arrived, I found a student in severe distress, gasping for breath. I was told that 911 had been called and an ambulance was coming. Somebody asked the student, who was known to have asthma, where's your inhaler? It was locked in the gym office and the coach was unavailable. And so Elaine's story, I wanted to start that out so we can kind of think through why this is important for schools to have access to rescue medication. This is a common situation, a child who already has asthma, it's known to the school, it's known to the parents, just didn't have access to their rescue medication. So in the United States, we know that schools should be aware of asthma and chronic health conditions because children spend approximately 50% of their waking hours at the school. And what schools often do is provide both acute and chronic health to children who experience these conditions. And often that encapsulates providing some sort of prescribed medication to manage their acute and chronic health conditions. We also know that most schools do not have a licensed school nurse. That is very common here in the state of Arizona. And what schools do instead is rely heavily on unlicensed assistive personnel who are typically trained by the school nurse or complete trainings so that they can provide not only medication management to the students, but also address some of the other common health conditions. Basically, emergencies at school do occur. We all know this, and emergencies the management of these emergencies can be affected by certain resources, such as socioeconomic factors or the nurse to student ratio. We know that asthma is a common condition, so often children will come up to the administrative office if there's not a nurse or health office, or to the school health office, and they might be wheezing, they might be experiencing difficulty breathing or shortness of breath, cough, a tight chest pain, or retractions. And these here listed on the slide are all signs and symptoms of respiratory distress and asthma. What we know about asthma in schools is when it's very common for children to experience these symptoms, and what well-respected national organizations have recommended, so this is a recommendation of evidence-based guidelines, is that they recommend that all asthmatic students have access to rescue medication at school. What that is a short-acting beta agonist, commonly known as albuterol sulfate. What we have determined across the US is approximately less than 15% of children have access to albuterol at school, and there's many reasons for this. It could be that simply the parents haven't notified the school that their students or their child's asthma status. They haven't filled out the required paperwork to put it on file with the school, and haven't dropped off the child's inhaler, that sort of thing. Or the child could actually have their inhaler at school, but maybe the inhaler is expired. It's not in the right place at the right time, as we saw in Elaine's story, or it's lost. So many children lack access to this rescue medication. And just to kind of overview Arizona, we have about 10% of children have asthma when we adjust it for age and other factors. But depending on the age, this was provided by the Arizona Department of Health Services, and we can kind of see where the state of Arizona, it has an asthma prevalence of 15.8%, which is about twice as high as the national average. And here in Pima County, we actually are high as well, with about 13.2% prevalence of asthma. So we already know that asthma is a common condition, but it's even more apparent here in the state of Arizona and in Pima County. And so just to kind of go back to Elaine actually, when that situation happened, she knew the child was going to die. The child that had this event was experiencing severe respiratory distress, and was to the point where EMS was on the way. They didn't have access to the medication. So Elaine made the decision to take the inhaler of another child, administer it to the child in respiratory distress, and she actually saved the child's life. She knew if she didn't give that medication right then and there that the child was going to die. And even though she saved the child's life, she actually lost her job. So we've been trying to prevent this exact scenario here in the state of Arizona from happening. And it was very important for us to protect not only schools, school administration and school personnel, but also the medical consultants who sign standing medical orders, the pharmacists who dispense the medication, and anybody involved in this providing of albuterol. And so HB 2208 was passed in 2017. It was signed into law. And what the law basically states is that schools can procure, stock, and administer albuterol sulfate to any student experiencing respiratory distress when administered by a trained person in good faith. That person does not need to be a licensed nurse. It can be any trained person at your school. And it's incredibly important because this law does protect, again, all of those entities, all the way from the school to the person administering the albuterol. But it also has specific language in the law to allow any students, regardless of previously known asthma status, receive albuterol sulfate. What we do know about albuterol sulfate is, sorry, I'm getting an echo here. What we know about albuterol sulfate is it's a very safe drug. It has a wide therapeutic index, and it's actually can be less safe to not provide a student having these symptoms instead of just giving them the medication. So what's a stock inhaler? What we decided after the law was passed was we wanted to find a way where this could be easily implemented in school. So basically a stock inhaler is just that one albuterol inhaler that is used among multiple individuals or students. We actually provide schools with the inhaler, the supply of valve holding chambers, and all of the necessary training and supplies to implement the program at your school. So how does your school participate? I know there are many schools on this call that haven't previously participated in our program here in Pima County. I will say that Pima County is the national example of program implementation when it comes to stock medications. We've actually implemented over 250 schools, mostly public schools, but basically our program implementation is being used as a national example to pass similar laws across other states. And so far, we are the widest and the largest implementation in the United States. The program is in its 6th year. I want to say 6th. It could be 7th already. COVID's kind of messed with my timeline here. Sorry. But basically, how do you participate? Well, the very first step is that, and we can provide information in the chat, which I will follow up with, but you're going to want to speak with your district administration or at least your business office or whoever is in charge of upper school administration, and just send them the information that we can provide you. We work very closely with not only Matt and the health department, but also Superintendent Dustin Williams' office. We have co-authored letters that we can provide, which talks about this program. And once that information has been passed to your district administration and there's kind of a go-ahead to begin implementing the program, we ask that you email stockandhealer@arizona.edu. I actually personally manage this email. So it will be me responding to you, but in years past, we've had enough staff to kind of monitor emails and basically provide technical support. And we're still trying to do that, but just know that it is me right now and I'll be answering it. We ask that you include your full name, your position, and the school's full name and address so that we can get some basic information and get over any other supporting documentation that you need to provide to your school administration. And then basically, I will do that through the email and kind of walk you through the next steps if you are wanting to participate in the program. Many of you are already participating, and I know that your health teams are not necessarily on this call, but we will be happy to provide you with a video link so that they can go through these steps with you. And I am working with most of the public school districts to get through each of these steps right now. But if you don't know if your school is participating and you're in a public school district, please just check with your district lead nurse or the nurse manager at your school district. They might already be aware or involved with getting your school started for this academic year. So check with them first. And basically what all of the schools are doing is we have that district lead nurse enrolling each and every one of your schools. So this goes district wide for each and every school that goes along with your particular district. We ask that they email us at the Stock and Healer email, but also you'll be signing into the school. You'll be signing up for the school surveillance medication program. Again, I'll put those instructions in the chat. And what we're asking, there is a systemic process or a very, I would say it's a linear process where you have to complete each of these steps, or the program lead at your school has to complete each of these steps before they can actually obtain the albuterol from Matt. It does include a little bit of baseline data. That's the most laborious part of this process. We collect data, basically the number of students at the school, the race and ethnicity, and the percent who qualify for the National School Lunch Program. We do that so we can basically standardize our data at the end of the school year. You will upload signed standing medical orders. I will state that not all schools have a medical consultant that is on staff and is able to sign that standing medical order. And so Matt and myself can work with you to obtain one. You will have to complete about a 30-minute online training, or each trained and designated staff who's going to be the designated person to administer the albuterol has to complete the online training. Again, we'll provide instructions. And then we just need to know who the program lead is for the school. And again, if you need the standing medical order, you can email me at stockandhealer@arizona.edu to obtain it, and I will get you straight on to Matt. But then we ask that you also review the program toolkit. I'm going to link that in the chat bar here. and then work with Matthew to obtain the program supplies. We are currently having them all supplies picked up at PCHD. So once you've gone through these steps and you're cleared to go, we distribute the supplies. And then we ask that you document each and every event in the SSMP system. So what the SSMP system is it's actually a database housed out of Maricopa County right now. This particular system is entitled the School Surveillance Medication Program System. All it was an existing system that was originally created for the H1N1, I think in 2009, the swine flu epidemic, and they were going to use it to monitor influenza cases, but it was never used. And so we thought, hey, let's go ahead and change this and use it for something that, you know, could be useful, like stock medications. And so the system has been adapted to document the stock medications at events that occur at each school. Why is the data important? Well, I'm very as a scientist, love data, but it's way more than that. We have to systematically collect this data so that we can keep the program funded. If we're not able to go and review what's transpired across county schools and look at the differences between, say, even private charter and public schools, and then see how this program is used, we have no case when we ask for more money in program funding. So we absolutely emphasize the importance of documenting each event in the system. And also we're legally required to by HB 2208, documenting each event needs to occur to stay in accordance with the law. We do have a standardized protocol for medication administration tasks. The online training does go over this protocol extensively. The standing medical order basically is written to this standardized protocol, and basically it's stratified, or I would say dichotomized by severe versus mild to moderate respiratory distress. What we do is we ask schools to absolutely abide by the standardized protocol and not a child's asthma action plan when using the stock albuterol inhaler. So what I mean by that is an asthma action plan, this standing order, if you're using stock medication and using the school stock inhaler, you need to go by the prescription that is written for that exact inhaler. If a child who has previously known asthma and an asthma action plan on file with you, and they just don't have their medication, you can't use their prescribed prescription and our medication. We have to use the stock inhaler standing medical order in order to administer that medication to the child. And this does happen. Most of our events are in previously known asthmatics who simply just don't have their inhaler at the school. So this question has come up in the past 5 years. Again, just emphasizing that we have to go with this standardized protocol if you're using the medication that we provide. The school documentation, this is what the SSMP system looks like, and it basically, in your program toolkit that I will link in the chat, that's what the documentation form looks like. But that's basically all the data that we've been able to look at and examine after the 5 years of program implementation. And what I will say is that this was a publication in 2021 that we actually did on the first year program data. And I really want to drive home why this program is so important. When we think of other stock medications, such as stock naloxone or stock epinephrine, we know that those are rare events, but actually albuterol or stock albuterol is not a rare event. This happens frequently where children need to take the medication. And before the law was passed, what would happen is schools had very limited choices. They could call the parents, hope that the parent picked up the phone and pull them out of work to either bring the inhaler to the school or ask that they pick the child up and sent the child home, right? Or if the event was severe enough, they would basically call 911 and have 911 transport the child basically for breathing treatment. We know that when a child and albuterol administration is delayed, that outcome for the child increases to increased morbidity and mortality. So even though the child could have received a very simple medication, a very safe and quick fix for this, often their healthcare is escalated because they were not provided with the medication to relieve their symptoms. And then sometimes that child ends up hospitalized as a result of this delay. So what our data actually demonstrated from this program here in Pima County was that 84% of events where a child used the stock inhaler resulted in them returning to their classroom learning environment where they could stay in the class and remain learning instead of being sent home, or instead of having that parent pulled out of work, and or instead of being transported via EMS. So this is a great program. It keeps children in the classroom. It's guideline concordant care. We need to be providing children with an option to relieve respiratory distress. And we do have the data to substantiate this. Here's my contact info. Again, please email me at thestockinhaler@email.arizona.edu or arizona.edu. I'll put it in the chat. If you want to participate in the program, great. If you have questions about your current participation in the program, I welcome them all to this email, and I'll try to take care of each and every one of you as quickly as possible. So again, thank you for your time today, Matt. Thank you for the time here to present this. And if there's any questions, you can please speak up or put it in the chat.
Question. Hello?
Sure. Yes, hi.
Okay, so you do have to have a minimum of 2 staff trained before you can apply for the inhaler?
No, what I would recommend is to apply and start the process, and then begin identifying 2 personnel at your school that will complete the training. What we won't do is provide albuterol until 2 individuals are trained at your school. Does that make sense?
Yeah, okay. I misunderstood that. I thought it said that I couldn't apply until 2 of us were trained. So
no,
okay.
Yeah, you'll have so many steps and probably questions before we get to that point in the process. One of the barriers in the past has been, especially for like smaller charter schools, is identifying a minimum of 2 personnel.
Yeah.
It can be anybody. It can be the PE coach. It can be other teachers. It can be anybody in the office. It doesn't necessarily have to be a full-time person. We just need to have a second person in the event that that primary person is not on campus that day.
Okay, thank you.
I actually recommend everybody get trained because asthma is one of those things, respiratory distress as well. It basically, you know, people are aware of it. Like, it does get brushed off a lot, but it is a rather large problem, especially in our schools. And teachers, you know, will be aware of it. But then there are a lot of academic outcomes tied to this. We know that children have with asthma experience like 2.4 additional missed school days per year as compared to non-asthmatics. And we know that there's also loss of sleep, and it can also in turn lead to behavioral outcomes. So having this is helpful when we can keep the child learning in the classroom. And so just having all staff kind of aware of it is important, I think.
And then I have just another question with your experience. I know, so when I started at the company I'm with, they used to keep the inhaler, especially for younger kids, in the classroom with the teachers. And exactly what happened with that story you were saying, it wasn't a life or death, but the teacher was on lunch and we were unable to get the inhaler because, well, the teacher wasn't available. So then I collected all the inhalers and kept them in the health office. So they're in a locked closet, but it could be the same situation. I'm off this whole week and all of the student medications are locked up. There is a front office that does have a key, but it's the same kind of situation. Everybody knows where the inhalers are, but little kids and even older kids that might need them, trying to get to the front office, let's get to the health office, and let's get that closet open, find your med. You know what I mean?
Yeah,
So that's
absolutely.
time consuming as well. So I don't know.
Very common.
Yeah. So with your recommendation, do you think it's safer keeping them in the classroom or in the health office? That's always just been a question in my mind.
Yeah, so what we recommend actually is, and again, every school's different. That's one of the things with this program that I am proud about, is we really tried to create it so that it was adaptable to different types of schools, the diversity of school resources, right? So often, and I don't know if you're at a public or a charter school, often charter and private schools have smaller campuses. They might have the primary and upper school or secondary, and they have two separate campuses with two separate buildings, right? So we actually recommend, depending on the school, putting inhalers at a centralized, quickly accessible location. Sometimes it's appropriate to have multiple inhalers at a school, especially if you have a known severe asthmatic. We absolutely tell schools that inhaler should remain unlocked in a good, safe, secure location, but not locked. Locking causes many, many issues when it comes to rescue medication. And what is very important to know about albuterol is modern day formularies. They are extremely safe in children. So they have a wide therapeutic index. It is more likely the child will have benefit from it, even if they don't have asthma, and more risky to withhold that albuterol, even if you don't know that child has asthma. So unlocked location.
Thank you very much.
You're welcome. And I'm gonna drop some materials in the chat here if you give me just 1 minute. I think this will be helpful for you all to kind of walk through everything.
Hi, Ashley. It's Megan Joyce here with the diocese. It's good to see you. I haven't seen your face in a while. Hi.
I know, right? Megan's been participating for like 5 or 6 years. 6 years.
It's been a while.
Yeah.
Thank you so much for doing this, and great presentation. I just had a quick question. So if we have schools completing their SSMP enrollment at different rates, am I allowed to pick up the inhaler for the schools that are already completed? Because I feel like it's going to take a while for all the schools to do it, because they wear a lot of different hats at the school, and some people might get to it a little bit quicker than others. Can I pick up the inhaler for the school that's completed and do it that way, or do we have to wait until every single participating school is completed, the SSMP?
Yeah. So I'm probably going to give a bad answer here, and I apologize. For you, just because we have experience working together, we can make arrangements for you to kind of be that gatekeeper. We definitely want schools enrolled in the program, because if we don't enroll in that, it is a laborious process. It's not very straightforward. I do promise you all that the SSMP system gets easier once we're enrolled and ready to kind of go. It's very easy to document events. The health staff will have a very easy time documenting once we get to that part. But getting enrolled is laborious. And so we definitely want our schools enrolled before we're distributing, because what the SSMP system does is it basically certifies your school that you're in accordance with the law. So you've done every necessary step to have albuterol at your school and to basically administer it to a child. And so that's one of the reasons why we're using the system. The second is, of course, the data, because without the data, I will not be able to obtain additional program funding in years to come. And so the data is very important to me, and it is a systematic way to report that data. So we want all schools reporting to that. It helps fund the program, if that makes sense. So email me at Stock Inhaler, and we'll get you taken care of.
Okay, sounds good, Dr. Lowe. Thank you.
Thank you. And again, thank you, Matt, because I for whatever reason, cannot figure out how to link things in the chat. I apologize. I guess I'm a Zoom girl. So we'll get those. I have a program flyer for those who are new schools and interested. And then I have the supporting documentation and program toolkit for our existing schools. Are there any other questions?
Dr. Lowe, I just want to thank you so much for coming on this week and sharing this information. Teams makes it a little difficult to share attachments, and so we will include that. Yeah, we'll include that in our follow-up email. So for anyone on this call, if you forwarded this invite to your colleagues for today's training, be sure to also forward them the follow-up email that comes out, because that will include a lot of the information that she referenced in her presentation. I know we're over time, so I'm going to call the meeting, and hope everyone has a wonderful rest of the week. Hopefully most people get a long weekend to enjoy and relax a little bit. And we'll see you all next week. Thank you.
Thank you all. Appreciate you all.